not going to get any easier to collect anything, and we're certainly not going to get reimbursed any better from the Medicare program, etc. Budget-wise, the budget will be presented to you next month for the next fiscal year, starting July 1st. So you can look forward to getting that. That will go through a couple of reviews by the Finance Committee first next month, and then will be presented to you for your final approval. That's all I have.
Anything else? Any questions? Any questions for Jeff and Paul? We did discuss the fact that we're going to bring up to the designated fund.
Okay.
Okay, thank you, Paul and Jeff. CNO report, are we on Glenn?
You guys do have our CNO report in the packet. So I'm sure you looked at it, and if you have any questions, one thing I do want to, Glenn and I are very happy about is our HCAS rate over 8 and 10. Our staff, so we're pleased that they remain high. We made a little bit of gain in surgical area also, up to 21%. Each month we seem to gain a little percentile with the interventions we're doing, so we're pleased with that. And we'll continue daily monitoring of it. One thing that is not on here is our mini health fair. We are doing, our marketing committee we're doing a mini health fair for our community, and it's called Summer Safety Fair. It's going to be Saturday, June 20th from 10 a.m. to 1 p.m. I know that you guys all do paychecks. If you want to send this out, with your employees, we can get you some if you'll just let us know, let Jill know. And what we're going to do, it's going to be at the MOB, advertising our MOB. It's in conjunction with Teachers Foundation. It's going to have bicycle safety, summer health. We're going to do the CPR Heart Start. We're going to do electrical safety, camping and outdoor, first aid tips. But just another, you all know that we've been doing these every quarter, and we're continuing with them, and this is our next one. So if you would like to advertise for us. I believe that that's about it. Any questions from the report that we submitted?
So you guys hired 2 new nurses?
Oh, yes.
That's good.
We're really excited. They're experienced nurses, greater than 20 years experience, both of them. One from North Dakota and one from Tucson, Arizona. One starts June 1st and the other June 11th. So we're very excited about that.
We'll be able to get rid of our nursing contracts with these hires.
Good.
That'll make Jeff happy.
Yeah, I was going to say that. Doesn't take much.
We aim to please.
Any other questions?
We did do that graduation. You saw the NMSU graduation. That class, because you guys are all involved and you pick those scholarship students, that was an 8-person class, down to 4, down to 2 that graduated. So the other ones there's 3 of them that'll be pulling up, this next semester that are scholarships, and we're going to garnish one of those.
And they did a beautiful job at the graduation.
Yeah.
Thank you, guys. Any other questions or comments?
So when will that new graduate start here?
Well, we're maybe counting our chickens before they hatch. He has graduated. He has to take his boards. So all his stuff is sent, his transcript, he's waiting for a test date. And as soon as he passes his board, we'll put him on. He precepted here. He's actually a nurse's aide here. He did his preceptorship here, which they do 180 hours. So we've already got a jump start. So if he passes, his orientation won't have to be quite as long. So we're excited about that. And they do report that they're going to have a full cohort this next in August. So I'm sure we'll be looking at some more people applying for that scholarship.
Hey, when do you guys do scholarship, the committee?
It was in the fall that we do them.
I think this last time we started discussing it in July, so that it would be ready by August.
Yeah.
Something like that.
And the scholarship isn't only for nursing, any clinical area that, if you guys do.
Thank you, guys.
Welcome.
CEO report?
Attached to your information is a CEO report, and I'll just hit some highlights. One thing that wasn't on there that we got notice today, that we have applied for the ACO, that's the National Rural ACO, and that application has been sent to us, so Jill and the committee is filling that out. We've got an invoice for the $1,000 fee, and so that'll be paid as soon as we can get the accounts payable out, checks in the mail. So that'll be paid to them. Then the $24,000 total application fee will be paid by July 1st. So we're in the process of filling out the application. They will be on site here inspecting the hospital and reviewing our application and helping us if there's any area of concerns that we have in filling that out, how to fill it out, how to get all the commitments we need from the physician standpoint, and getting that ready, because we need it into them by, we're going to try to get it in by mid-June, but the deadline is July 1st on the ACO, Accountable Care Organization. And so that's up and going strong. The medical staff has been invited to meet with this individual, Doug Pollock, that will be here June 1st to answer any kind of questions they might have about the ACO and how it's going to affect them, what's their role in it, how the transition is going to go. And so that'll be available. And then any board member who wants to attend that luncheon, you're sure welcome to attend and ask any questions.
How's the feedback from the docs and our staff on this project on this?
I've been given the employee forum. I think I've given 6 or 7 to the employees, trying to explain the concept and how it's going to work. And so right now, most of them are saying that, that's what's going to be the future healthcare kind of protocol to use. So, just getting us on the ground floor is a good thing, getting us used to it, getting us looking at wellness and community health and seeing how that we can support that. Nobody's real enthused about changing, but but at least they're looking at the future and what really needs to be done in the future. So that's why it's going to be important for us to keep communications with the medical staff, making sure they're on board and making sure they understand what's coming up and the time frames and everything that's involved with it. Then he'll meet with the executive team after that, and then after that we'll be reviewing the application and seeing what's needed. So we think we're right on schedule with that. Hopefully we're a little bit ahead of schedule and getting all that information into him, so it looks real good right now. Dr. Shipley will give us an update on Dr. Fabio. She's recruiting Fabio to the hospital.
Get a little older. So are we.
Is that Italian?
He said he has a wig in his car. Dr. Gutierrez and Dr. Vitale both are doing a great job over in the clinic.
Valdivia.
Okay. All right. And, when we first started discussing him and Carl coming over to the clinic, we was looking for how we could change the culture of the clinic and how we can look at processes and improve a lot of processes over there. And so I think with Arnold there seeing, 40 patients a day, averaging 30-some patients a day, it shows them that it can be done and can be done in a quality manner. And so now it's just getting that culture to start that process of improving everything that we do over there. And so we think it'll be good for the clinic and good for the hospital.
Dr. Gutierrez staying busy too.
Yeah, he is. The other one is Sheila Cox will be retiring 2nd, 30-some years of practice. She's done a fantastic job for the hospital. Be sorely missed. She's just a very high-quality individual, and we'll miss her. Marcy Chavez will be taking over her position as Director of HR, and we're in the process of starting to recruit a marketing person to take over Marcy's job in marketing. So that'll all occur June 2nd and 3rd. Any questions on any other part of that? Well, one thing, next board meeting, we'll be reviewing the strategic plan. I know you had access or input into that plan, and so we've got the final product back. So the executive team is reviewing it and looking at completion dates for a lot of the plans and who's going to be in charge of those plans. And then we're going to be getting it done this month and be presenting it to you, to the board, for your review, for your input, and for your vote next month.
Thank you, Bob. Any questions for Bob? Okay, medical staff report, Doc's not here. CMO report, Dr. Shipley.
Wait, QHR.
Oh, I'm sorry, Barbara Brooks. I just wanted to hear you, Doc.
Talk about Fabio?
Yeah, I wanted to know what Fabio's all about.
I know. I'll tell you later.
All right. In your packet is the Q-view for this month, and it's just talking about the emergency department volumes. We discussed that a bit in Finance Committee today as well, but just some of the reasons that the emergency room volumes are going up across the country. Also, I think you all have been sent the link for the QHR trustee survey. And we would nod in your head, shake your waist.
That was the link.
Okay.
That was the link that was sent to you on the email.
Okay,
Like on
so
those
I
two
just
questions.
asked you all to fill out the QHR trustee survey. Satisfaction.
A while ago, Couple
Maybe
months.
so,
You're thinking about the self-evaluation.
there was a difference. There was a self-evaluation. It was the link one on the computer. I'll show you if you want to. Okay.
Is there a deadline on that, or is there a date?
The deadline has actually passed, but please go ahead and fill it out because the woman whose job it is to compile all that, she's out of the country anyway, so just wait until, you have plenty of time as long as you do it this week. How's that?
That's good.
Okay. And also, I need to report, annually we report to the board it's called our annual disclosure regarding administrative fees, and it's through the Quorum Purchasing Advantage. And you all get, the report goes to Ron, and so the highlights of the report are that we have to inform the board as part of the law about the administrative fees that either HPG receives or that QHR receives. Generally, the way the discounts work, there would be, we have a safe harbor in the kickback statute that allows us to get administrative fees. And HPG, and this is kind of the way it's been forever, that all group purchasing organizations are paid administrative fees. That's how they make their money. And so we have to report to you any administrative fee that's in excess of 3%, and there's a long list, and you all can see those if you would like. And so the main part of it is that we report to you the savings, and that's also part of the report that we present to you. I can't remember if I did it or Tom did it. That annual savings, contract savings. So it's the same numbers, if you will, from the savings from HPG and from your using strategic service partners. So, for instance, on the strategic service partners for 2014, which is the calendar year of 2014, you all had savings of $123,000 on all of those contracts. administrative fees that were paid to QHR were $25,000. Also, you had total purchases through the HPG contract of about $2.4 million in 2014. And the contract, the administrative fees paid on that were $55,000, of which QHR gets half and HPG gets half. You also received $26,000 in rebates, and I know we say this when we do your annual report, but most group purchasing organizations that are out there do not pass the rebates to the hospitals. That's something unique to HPG. So that's $26,000. You know, if you'd been with some other Premier or somebody else, they would have just kept those. So,
And
anyway.
I have a copy of that. If
Yes.
you guys want to, just thumb through it, I'll pass it to you, Chase.
Anyway, I've done my duty.
Thank you, Barbara Brooks. Any questions, comments? Okay, Bob.
Okay. The,
You read it.
part of my report is the PIC committee report, and this month we had the department that came to the meeting, which was on May 13th, 2015, was the pharmacy. And the pharmacy had some really nice things that they're doing, lots of things that they've been doing to improve and to restructure and to do all kinds of things for patient safety and satisfaction. One of the things they're doing is a formulary review. We have to go through and try to review what's on the formulary to be sure that it's accurate and up to date. They've been working on that. The pharmacy has also become very closely involved in discharge of the patients, which is a wonderful service where a pharmacist will visit each patient that's being discharged and review their medications, how to take them, what they're taking. Really gives some good information because that's such a critical time, and for them to know what's going on. And it's increased our patient satisfaction scores in that area from 46% to 96% is what Randy gave us. So that, you can tell, that helps a bunch. And we're hoping that will help people stay out of the hospital, not have to come back because they understand the medications more. So we're really excited about that. They're also, the pharmacy is part of the kind of triad with antimicrobial stewardship. It's not an actual official committee at this point, but with infection control, Daniel, and with Marie and micro and the pharmacy, we're really working on addressing the issues of the appropriate antibiotic being given for the infection that's occurring. Because that's something all over the world you've been hearing about, the superbugs and all that. And you give too many, you just shotgun antibiotics to everybody, and you grow lots of weird things. So part of this is to be sure that you identify what's growing and you give the right antibiotic, and that's really exciting. Daniel's been very active in that along with Marie. And the pharmacy, and that's, that's a wonderful service. Also, Randy became ACLS certified, and that's very helpful during codes, and to have that information, be a little bit more familiar what's going on, and the other pharmacists will do that as well. And they've also started a pharmacy newsletter to the nursing staff, and that's every month.
Yes.
And they give updates on medications, what's available, what's not
Actually,
available.
their newsletter's not going to be every month, but their visit to they're coming to our staff meetings. So
Okay.
every month they're coming to staff meeting we're going over a certain drug or something for education and staff meeting.
And that's a wonderful service too, because you can't keep up with all of those medications very well. And then, these are all highlights. There are a lot more going on, a lot of more things going on, but he also mentioned that the Sun RX 340B program is starting, and that is to help the patients afford their medications better, is the whole purpose of this thing. So that's a program that we've just started last Monday, I think, or recently. So those were some highlights from the pharmacy, so if you see them, just thank them for all their hard work, because they really are working on these things. And then the other part, our lean plan, one of the lean processes that we're doing for the hospital-wide organization improvement is registration and the patient experience and registration. And we have moved, as you all know, I think by now, we've moved the registration clerk from the end of the hall down next to the cardiopulmonary area across from lab, so that people who are coming in for those services can register right there and not have to walk all over the place. And it seems like that's really, we're hearing good things on that. So that was cool. And then we're working on other processes of that registration between the clinic and the hospital and trying to streamline things and make it more patient-friendly. So that's pretty exciting too. And there's a lean conference coming up that 4 people from the hospital are going to attend. The 4th person is free because the others cost so much. No. But the lean conference is for Greenbelt. And Glenn is going. And who else?
Isaac Atencio from radiology, Matt Munson from pharmacy, and Nicole from the emergency room.
So we decided we thought it'd be really nice to have different,
Is it actually a green belt?
It's a green belt.
they're going to
Lean
get
Six Sigma.
green belt, they're all gonna be lean. And so we have several departments involved, and we feel like the more diversity that we have in the departments, the more it's going to affect all of the lean processes going on. So we're pretty excited about that too. And that was it for the PIC. Now, as just a reminder for we've kind of gotten away a little bit with, in the last few months with board education, because we've had lots of things on the agendas. And one of the things that we wanted to go over was the fact that as part of the board bylaws, one of the things you guys all wanted to know about was a little bit more about the bylaws. So one of the issues was the annual meeting, and I was going to bring that up today, because in the board bylaws, you have to have an annual meeting in July to elect officers. That's one of the primary things, that you have to elect officers every year. So we wanted you to start thinking about those things, who you want to be the officers, and whether you're willing to continue or do whatever in that officer category. You also appoint committee members, so think about the committees that you're going to be wanting to be on. And then you do the investment authority for the corporation accounts for the next fiscal year. Every year you authorize that. And you establish the regular monthly meeting schedule. I don't know if you realize that it's really up to the board on when and how you want to do the meetings every month. So it's been different things in the past. It's almost always been on Mondays. It was on the 4th Monday for a long time, and then it became the last Monday. I don't know if that was the last board meeting that you decided, the last year annual meeting. But it's up to you to decide how you want it. You think about whether it's better to have it on the 4th Monday, a certain Monday, or just the last Monday of every month. Often the last Monday is a holiday, like it was this time. But that's something that it's up to the board for you to decide. And then you adopt the meeting notices. You know, there's rules with the Open Meetings Act on how you do your notices, and you can change them within the law and do that. So those are things to think about. And then I guess also new members that are coming up. Did you?
Carlos has been reappointed to the board to fill a hospital spot. And so we got 2 other vacancies. One, Dr. Deming resigned, and the county needs to appoint her. And then Paul, terms run out at the end of June. And so they need to either reappoint him or appoint another member to replace him.
So Paul was a county appointee.
Yeah, change their county, so.
Carlos was a hospital appointee.
Yeah.
So
he's-
3 board positions, huh?
He sent a letter to the county telling them that these are coming up.
It was on their agenda last month, or this month.
Lloyd said they didn't do
Yeah,
anything.
for one position.
That they already talked about? Or?
Well, I
It's coming
was
up.
at the county the other day and I seen the agenda,
Oh, okay.
so I don't know when it was spoke, but it was on the
Yeah,
agenda.
Lloyd said they didn't do anything.
There's no action.
because they're all up on the 30th. So that's part of your bylaws. Any questions about that? Just do little snippets periodically so that we can go through the bylaws and know, be familiar with them and ask any questions.
So we'll have a meeting in July.
Yes.
Sure.
Oh, and that's the other thing, you can decide if your regular meeting in July will be that meeting, and we always do. I think traditionally, whatever your July meeting is, becomes the annual
That's what
meeting,
it
as
is.
long as you guys want it.
Okay. I'd like to leave it like that, so it's all right, guys. Just do it all.
So that would be your meeting, and then you'll do that stuff. Okay, any questions? That's it? Oh,
You see him, though.
what?
You guys talk about Fabio.
Oh, Fabio, my most important one. What is wrong with me? Dr. Fabio Spadano is Italian, and he and his wife, they've been in New Mexico, they're familiar with New Mexico, he did his residency down in southern New Mexico in Las Cruces. His wife did her master's and master's and PhD down in Las Cruces. They both worked in Albuquerque and around in different places, and they really love New Mexico, and they really love this area. They've been up in Michigan because they took a job for her, and they're just homesick and they want to come back, and we have them down to interview, and we're working on different issues that with his wife getting a job like we've talked about, the family has to be happy, and there's a good chance that hopefully this will work out. So that's one of our recruitment things, and we're talking to a couple of other people, just as more temporary kinds of things, and then looking into perhaps another internal medicine doctor, which can be difficult. So at this point, we're doing pretty well, and as you know, VMS's new doctor will be starting in August. He's family practice, and his wife will be coming next year. So things are looking up, and as Bob said, the clinic is doing really well right now, and we're pretty excited.
Any questions?
And Fabio had short hair. He was cute.
When is he hoping to make the decision?
Soon, and I would say hopefully in the next couple of weeks. Yeah.
Probably.
What does she do?
Now, and it may not be a final decision. I mean, they both have good jobs in Michigan, so it's not a rush.
What kind of a job is she looking for?
She is a college instructor, PhD in biology and ecology and GIS. What is GIS? Tell me.
Geographical
Information
systems.
systems. They do
Yeah.
sensors all over to tell, I don't know. We'll go-
Mapping.
Mapping. And she just loves all that, and loves teaching biology, and she'd really like to teach at the college, and so, please put in a good word for her. She's a neat lady.
Yeah, she's be interviewing Thursday over at
For a different position, and then there may be a
GIS
position.
service for the Acoma.
Right.
That's a good.
So we're keeping our fingers crossed, and then there's always an opportunity that she may be able to teach at the college, and that's what we're hoping for eventually.
Thank
Thank you.
Yeah. That's it. Thank you for reminding me about Fabio.
Dr. Gutierrez, medical staff report, since you're here.
You like who? Medical staff report. Let's see, what did we, all we did for medical staff was we were arguing over the consents for anesthesia was the big issue there. The ER physicians feel like we don't need to have consents done before they give analgesics. And historically, the way we've done it here is that the patient has to be sober for 4 hours before we get consents. And so I don't know if it's the majority, but quite a few of the physicians that are involved in taking care of patients want to be able to give analgesics and get consents while they're still under the influence. Apparently, it was looked at both in whether or not other hospitals do it, and they do, and then it was looked at medical legally. We, I guess, sent it off to our lawyers, and they said some wishy-washy things, sort of like, you do whatever your hospital's protocol is. So, that's where that started. That's where we started. And other than that,
Wishy-washy like.
excuse me?
Roseanne's gonna write everything I say, now stop.
What?
Your voice is being recorded.
Oh, well, stop that recording.
You're on TV for sure.
I don't care what they record that was.
No, it was not. You know, I think pretty much that was it.
Yeah, that was pretty much the big issue with medical staff. Other than that, we didn't have anything else going on.
Okay. Thank you, Doc. Any questions or comments for Doc? Chairs?
Damn, I've been demoted.
In one of those days. You're not demoted. Doing well.
Promoted.
Demoted. One thing worse would be calling you Shipley.
You would be so honored and
You'd be happy.
Yes, he would.
With that, I entertain a motion to approve the consent agenda.
So moved.
Okay. Second. Okay, roll call. Chase.
Aye.
Carlos. Aye. Nestor.
Aye.
Paul. Aye. And Dr. Ritos.
Aye.
Okay, no old business, no new business. I'll entertain a motion to go into executive session.
Ooh,
I second.
I'm glad to stay at the office more often. So moved.
Okay, motion, Chase second. Chase.